These are some of the 31 recommendations released today with the goal of reducing harm caused by problem gambling. It proposes a four-step plan to phase out gambling ads over the next 3 years, beginning with a ban on inducements for online gambling and a total ban on radio ads during school drop-off and pick-up hours. The next phase would see gambling ads removed from stadium billboards and player jerseys, as well as a blackout period covering an hour before and after live games. Phase 3 would outlaw all gambling ads between 6 a.m. and 10 p.m, leading to the final step, a total blanket ban. For more on this, let's bring in independent member for McKellar, Sophie Scamps. Thanks so much for your time. Do you welcome the recommendations of the committee?
Yes, of course I do. This is something that people all across Australia are calling for. Whenever I talk about, regulating junk food advertising, people jump on the bandwagon and say, please do something about gambling advertising. We know our children are being deluged by this, both when they're watching telly with their families, trying to watch a family show, and online, and particularly insidious is the online, very targeted, very individualised marketing of gambling to our children. Young boys particularly are being deluged with gambling advertising.
The recommendation too, and I ask you this, I'm interested in your thoughts, particularly as a doctor. It says the strategy should be based on public health principles. What's your read on that? Is this really a public health issue, or is it more just a social issue?
Oh, look, thank you. That's a great question. I guess it's both. It 100% is a public health issue, because we know that gambling has multiple harms in terms of people lose their housing, in terms of crime, and in terms of domestic violence, family breakdown. It's a major public health problem, and it is societal wide. We've seen this flourishment of advertising across all different channels, and it's time to bring it back under control and really start to look after our young people. We also know that the younger people are, when they're exposed to gambling, advertising and marketing, the more likely they are to fall into harmful behaviours with gambling.
The industry says that a blanket ban goes too far. They would like to see a cap. Would a cap and time restrictions be enough to satisfy your concerns?
I think we need a comprehensive ban. There have been trials at limiting different types of gambling advertising in the past, and they just have not worked. And we know that industry self-regulation does not work. There's just been an increase of exponential rise in gambling recently, gambling advertising, I should say. And we really need that comprehensive ban. And I think it's a really clever idea to phase it in over 3 years, so that there is time for both broadcasters and major sporting clubs to wean themselves off this gambling advertising, revenue.
Yeah, indeed. But I guess the other side of it is, if people want to gamble of their own free will, not everyone is a problem gambler, of course. So shouldn't this industry be allowed to survive?
Look, I think that the gambling industry will survive. It will still be there. And of course, there's decisions that people make around their gambling. And of course, many people are not harmed by their gambling behaviour. But then, of course, we have to balance that with the very large harms that we know do occur to many people. And we know that Australians, it's almost like gambling is to Australia what guns are to the US. People are being harmed by this. Yes, that it may have a place, but we need to regulate it so that our children are not being deluged by this advertising, and that we are actually creating environments that are healthy for our children. As I said, it is a public health issue for many, many reasons, and we need to be looking after our young people, and parents across the country are calling out for this. This has been driven by people in Australia, and I think that the inquiry has really responded to that.